Hi, my name is Kendra. I'm going to be presenting POTS. Today with my audience is Ariana, Mike,
Hi.
and Missy. Alright, so I'm going to hang up the camera right over here. I think that's where you can see the screen. Nope. There we go. Thank you. Okay, so I'm going to be presenting POTS, which is my topic today. So let's get right into it. So why I chose this topic is to spread awareness about POTS because it is an underdiagnosed disease that can cause many complications, and it usually just goes under the radar. So does anybody know what the nervous system is? Anybody? Don't worry because I have the answers on the next slide. Does anybody know what dysautonomy is?
Dissociation?
No. Somewhat. And then what is POTS?
The fainting
Yes.
disorder.
Yes.
AKA.
Okay, good. So the answers. The nervous system is the body's communication pathway. That is where your nerves are and how they tell your body what to do. Dysautonomia is the nervous system disorder. So that's a malfunction in the nervous system. These are just things that you'll have to know. These are just things you'll have to know in order to know what I'm talking about through the presentation. And then POTS is a syndrome making pulse elevate and drop sharply depending on posture. So a good fact that we could start off on is according to Dysautonomia International, 80 to 85% of people who have autonomic dysfunction are women. I actually didn't know that before I started this presentation. So why should we care? Well, as I said earlier, they usually fly under the radar when it comes to diagnosing, and only 25% of people are diagnosed their first time visiting the doctor according to the Journal of International Medicine. And this could be anybody because all of us have a nervous system if we are living. And I know this because I've been living with POTS for close to 7 years, and I have people in my life who have been affected by POTS. Okay, so the key points we'll be going over today is what is POTS, what are the symptoms, and how can you manage POTS. And we have learned our key terms in order to understand this presentation better. So POTS stands for postural orthostatic tachycardia syndrome, which means postural, it's affected by posture, orthostatic, that's your heart, tachycardia, fast heart rate, and then syndrome. So a syndrome that affects the heart rate based on posture, which is what the name means. And then it's usually mistaken for seizures or vasovagal syncope, which means random fainting, which is what I was diagnosed with when I first went to the doctor over my symptoms. So what you can expect is fainting because it is a fainting disorder, lightheadedness, blurred vision, brain fog or confusion, fatigue, chest pain, hot flashes, and migraines. And I got all of this off of my own experiences and from the Cleveland Clinic. And this happens usually because of low sodium. It can also be because of protein deficiency, smaller sized hearts, making the hearts work harder in order to keep up with average blood flow, and brain trauma. And parts of the brain that can cause this when they're damaged is the amygdala, which is the fight or flight response of the brain, the limbic system, which is the regulatory system, and if you go to the hypothalamus, which is directly connected to the limbic system, it can also be in the message center, which means that the messages that the limbic system is sending to the hypothalamus isn't being received correctly. There is no cure, but you can maintain this disorder by increasing salt intake, increasing water intake, and using blood pressure medications. But of course you have to speak to your doctor before this or before using immunosuppressants. And these immunosuppressants would be used to prevent the immune system from attacking other parts of the body. You can also avoid caffeine, which I struggle with doing. Okay. So, in my conclusion, since we're coming to the end, POTS is a very common yet very underdiagnosed disease. And now that we know more about what POTS is, what it does, and how to maintain control of your body, we can help bring awareness to the disease, which is my entire point of this presentation. And you need to go see a doctor if this relates to you, because the condition can be easily overlooked, sorry. So 2 more facts that I can hammer under your head in order to make you go to the doctor. Patients have been found not to be diagnosed until 5 to 7 years after they first see a doctor for symptoms. 75% of patients also reported being misdiagnosed prior to their final diagnosis of POTS, according to the Journal of Internal Medicine. And here are my sources. Thank you for listening.
You did amazing.
Thank you.
That was really good.
I don't know who your professor is, but she deserves an A.